Hello everybody. This is Dr. Rasan Tarabine, an American board-certified neurologist and neurosurgeon with numerous national and international recognitions and awards, including Top Doctor in America and World-Leading Physician. Dr. Tarabine retired recently to write books and coach doctors worldwide. Find more about him at drtarabine.com. There are a number of neurological symptoms and signs that people often overlook. Some of those signs can be a warning for serious and even fatal conditions. Here are the top 5 most serious neurological signs. Knowing them can save your life. One-sided pupil dilatation, called Anesochoria. It may be normal without underlying cause, known as physiological Anesochoria. It is when there is a natural, typically less than 2 millimeters difference in the size between the pupils of the two eyes. Physiological Anesochoria is not harmful and does not require treatment. However, sudden and pronounced changes in one pupil size can indicate a serious neurological condition. This is a 34-year-old woman who presented to the emergency department with a sudden onset blurred vision in her right eye. The ER doctor sent her back home with the advice to follow up with an ophthalmologist. She went into a coma 3 days later and died in 2 weeks. She had a right PCA brain aneurysm, which extended rapidly till it compressed her oculomotor nerve, the third cranial nerve, causing failure of her right iris muscles to constrict, resulting in dilation of her right eye pupil, till the aneurysm eventually ruptured. The nerve fibers that control the iris run so superficially that pupils dilatation is an early sign of oculomotor cranial nerve compression. Had she had the right evaluation at the ER, competent enough to realize that sudden onset one-sided pupil dilation constitutes an emergency, her aneurysm would have been clipped before it busted out and killed her. If you have a sudden onset dilatation in one eye, this is a time-clicking bomb. It may be fatal. Don't ignore it. Treat it as a serious emergency. Spells of numbness, dizziness, or slurred speech. Trouble speaking, along with having a numb or droopy face, or feeling weak in one arm or a leg, are common signs of stroke. When the oxygen supply gets reduced or cut off to your brain by a blood clot for a brief time, this can be a TIA. It typically lasts for minutes, but less than 24 hours. It's called a transient ischemic attack, or TIA. Unlike a full-blown stroke, a TIA does not cause permanent damage. Other common symptoms of TIA are sudden confusion or trouble speaking or understanding speech, sudden vision problems in one or both eyes, sudden difficulty walking or dizziness, loss of balance, or problems with coordination. Never take any of these signs lightly. Each of them is a warning for an upcoming stroke in the near future. There are several treatments available nowadays, so long as stroke gets recognized early enough, and before it is too late. There is some treatment out there that can save your life. This is a 39 years old, otherwise healthy man, till he had a massive stroke, presented to the ER a week after the onset. He was too late to benefit from any treatment, and died in a few weeks. A pie in the sky. It is a gradual loss of the upper visual field, commonly called a pie in the sky. It is caused by a brain tumor, usually is in the pituitary. Visual defects are commonly caused by structural brain lesions, like brain tumors, stroke, or abscess. Although it is gradual, mostly affects the elderly. Nonetheless, such signs are too serious to be ignored. If you experience vision changes, especially field defects, you can have a serious brain disease. See a neurologist as soon as you can. Double vision when looking to the side. If you have slowed or limited ability to look to either side, with a fluttery and voluntary movement in the other eye, called nystagmus, you may have INO, or intranuclear ophthalmoplegia, caused by damage to the midbrain, most commonly due to MS, multiple sclerosis. It is a potentially disabling disease of the central nervous system, the brain, and spinal cord. In MS, the immune system attacks the protective sheath, myelin, that covers nerve fibers and causes communication problems between your brain and the rest of your body. Signs and symptoms of MS vary widely, depending on the amount of nerve damage and which nerves are affected. Eyes are commonly affected. Some people with severe MS may lose the ability to walk independently. or not walk at all, while others may experience long periods of remission without any new symptoms. Here are some of the most common symptoms. Fatigue, vision problems, numbness and tingling, muscle spasms, stiffness and weakness, mobility problems, pain, problems with thinking, learning, and planning, depression and anxiety. There's no cure for multiple sclerosis. Treatments can only help speed up recovery from attacks. MS is a leading cause of disability at young age and premature death. Muscles twitching. We all have muscular spasms from time to another, but having muscular twitches of this type can be serious. It is almost pathognomonic for ALS, also known as Lou Gehrig disease. Lou Gehrig was a famous baseball player for the New York Yankees. He played in more consecutive baseball games than any other player, until his record was broken by Cal Ripken Jr. in 1995. Throughout his career, Gehrig was a symbol of indestructibility. The Iron Man of baseball. On May 2, 1939, he pulled himself out of the lineup of players for the good of the team. He was not playing well, he knew that something was physically wrong. Within a few months, Gehrig was diagnosed with ALS. He died 2 years later. To this day, ALS is still most closely associated with his name, often referred to as Lou Gehrig's disease. Every 90 minutes, someone is diagnosed with ALS, just in the USA. About 90% of all ALS cases are sporadic, with no known history of the disease in the family. The remaining 10% of cases are known as familial ALS. Generally speaking, anybody may have this fatal disease. There is nothing one can do to prevent it, much less anything to treat it. The FDA approved only one drug, riluzole, which may extend life with ALS for up to 90 days. Affected people with ALS don't usually survive beyond 2 years. This is Mr. Lou Gehrig in his final days, before he died. Those were the top 5 most serious neurological signs and symptoms. If you can recognize them, you can save your life. Even with Lou Gehrig disease, knowing that you have only 2 years to go makes you live the best 2 years of your life ever a person could imagine. Stay healthy, and stay tuned to Dr. Terabane's YouTube channel and his website at drterabane.com.